But hi, everyone. I'm Veronica. As I wrote in the chat, I worked with Healthy Capital District on several projects, one of them being building this mental health resource guide. And now I'm working as a HARP care manager for CDPHP. So thank you all for having me. And I'll just review what's in this guide and the purpose of it. And at which shouldn't take too long, but then if you have any questions, feel free to type them in the chat or ask me, and we'll have a little bit of time to go over them. So first, I'm going to try to share my screen, and perfect. Do you see that? It should be, okay, awesome. So when you click on the link to the guide, this is the cover page, and where I want to start is just, obviously, I hate to sound so remedial, but with the table of contents, this is what each section of the guide is. So you may be working with a client who may be expressing some distress and not sure where to go next. So first, I definitely want to say, obviously, if they are having thoughts about killing themselves, that is a mental health crisis. If you're really afraid of their safety, 911 is an option. That obviously, again, if it's imminent, 911 is really the only option. If they are just in a state where they're having thoughts, there's no real plan, perhaps they've been down for days and days and days, or having a lot of panic attacks, a lot of anxiety, a lot of sadness, which we are in a pandemic. It is the winter time. People aren't seeing other people as often as they were, so those are definitely adding to mental health symptoms. Plus, the mental illness is really common, so many people struggle with these issues, as I'm sure you've seen in the course of your work. So when we get to a crisis, the options there are mobile crisis, which this comes in handy if you're not familiar, they will actually come to you. They will come to your client on site. So during the pandemic, they'll start out with a phone call for the most part, but then they will go to the client's location, which is really, really great. And then they can do an assessment and determine the next steps. So for this section, if you want that type of service, then just look for the one that applies to your county and your client's location. Now, if the client is expressing that they want to go to crisis, or perhaps you're on a call with them in person and can drive them there, that's what walk-in crisis services are for. And these are often at a mental health clinic or at an emergency department. So again, just take a look in the target audience part for the correct county and the correct age. Because some are targeted for adults only and others for adolescents and children only. Okay, so and so again, the descriptions for these are not going to be that different from each other, aside from a few exceptions, and to say whether they are adult, adolescent, and the location. Okay. So then the crisis hotline section. These are great resources to give to your clients who they need more support than perhaps you can give them. They may not be severe enough to go to the hospital or need to go to a clinic, for instance, but they need more support or someone to talk to in between sessions, in between appointments, things like that. So where this section is a little bit different is I put at the top the National Suicide Prevention Lifeline, Crisis Text Line, and the New York State COVID Emotional Support Hotline. I put those three at the top. I think that these would apply for when people are in a very, very serious state, having some thoughts about harming themselves, or if someone is concerned about the safety of a loved one. So this way you don't need to search through the list for these three important numbers. The rest of the list is in alphabetical order. Okay, so there's a variety of different resources here. So again, it is a long list, but target audience is going to be helpful here. So there are different resources for people who are elderly and lonely and need someone to talk to. The Friendship Line is a really great resource for that. There are resources here for victims of domestic violence, for victims of sexual assault, for the LGBTQ population. And also, I want to point out that on the next page is the eating disorders helpline and a veterans helpline. And so these are also very important resources, and I just don't want you to overlook them being on the next page. Okay. Now, later in the guide, we get to actual physical locations of clinics. So this is where someone is in need of outpatient services. They want a clinician, they want a psychiatrist, they want to get into care and see someone regularly, or it's being recommended to them, you're trying to refer them to resources. Where this is, well, how this is divided here is the first section is county outpatient treatment services, and so this is like the public option, and again, you would just look for the correct county and age group. One caveat that I want to note is that Schenectady County, they contract with Ellis. So you won't see a Schenectady County mental health clinic, but Ellis provides those services. So even though they're technically a private organization, they do provide the county services there. Then we have another section that is regional outpatient treatment services. And so they won't be restricted to counties or to residents of particular counties. It's more so they're located in those counties and can accept people from outside of the counties, but just geographically speaking and transportation wise, it may be more accessible to somebody who lives in that area. But so again, these are all private institutions, but work with a variety of people, and almost 100% of them accept all forms of Medicaid and Medicare. So that's why they're included on this list. It's not that I was looking for every single private practice, because then we would have pages and pages and pages, but just really the practices that would be able to work with our clientele and the people most in need. Okay, and then we are rounding out. A little bit different is the grief and bereavement support section. So this is something that is really, really common. We've all lost people in our lives, and many people don't realize that there is help out there and support. So, community hospice is the really big one in the area. They are doing everything virtually right now, but their services are still there. They support all of the counties in the region. All of their services are completely free. And I also want to note that the person that they are grieving does not have to have died in hospice care. It is literally open to anybody and everybody, and they have a variety of different supports, be it individual counseling, support groups for widows and widowers, support groups for children who have lost someone. There's a variety of them, including COVID. A COVID related support group for people who've lost someone due to COVID. So obviously check with them on their current schedule, but it's a really great free support for those who are grieving someone. Then, lastly, here is a treatment locator page. So what this is really good for is if you're not necessarily sure where to start, or if you're, for instance, looking for a provider, like a private provider who doesn't necessarily accept Medicaid. For instance, Psychology Today would be great for if insurance isn't an issue, or if you're just looking for counseling. Their web-based tool is really, really handy there. The New York State web-based services lookup tool can also be handy because you can just type in your zip code and turn up providers in your area and different types of services in your area. And lastly, I don't want to forget to mention SAMHSA. Their national helpline is helpful for people who are looking for referrals for themselves or support for themselves for both mental health and substance abuse related services, but it's also a helpful support for loved ones of these individuals as well, and it can help provide support and ideas for next steps to take. So that is just a very, very brief overview of the guide. As Shelby mentioned before, it is now prominently displayed on the HCDI website. But I guess, does anybody have any questions at this point?
There was one in the chat that I answered about the friendship line being free. So we did have that question. Did anyone else have any questions they wanted to ask Veronica before we move on?
And actually, I do want to note that the friendship line, it is based in California, so just double check the hours when you're calling. And if you ever go to their website, they do provide more services than the friendship line in California, though. So the friendship line is free and nationwide, but when you see other offerings like house calls and such, that only applies to, I think, the San Francisco area. So just keep that in mind. It would be really nice if we had that here too.
We have a question about, downloading the slides. The guide itself, you could download the entire guide from the website, and I can send you guys a link. I'll put it in just a minute in here, but I'll also send it in an email afterwards with the link. It's on the web, but you can then download it and save it to your desktop or whatever you want. Any other questions before we move on?
Just have another question. This is David from the Community Health Center. Has anyone actually used that friendship line? I have a huge population of people who are isolated and lonely, and for this, I'm just like, wow, this is great. We used to have like drop-ins and everything, but I'm sure as everyone else has experienced, we're just getting repeated, cries for help over isolation, and so has anyone used it?
So I have not used it with any clients, so to speak, but I did check it out to make sure that it was current information. So that is current as of end of October, I guess, when I worked on that section. So it is definitely up and running.
Okay, it's great because I literally just got off the phone with someone and they're just like, I'm just so lonely, and it's just we can only repeat phone calls to people so many times in a day, and it's nice to have another voice. So I think that's a great thing that jumped out at me. So thank you.
Oh, you're welcome. I'm glad that you found that helpful. And again, I think that's one of the benefits of the hotline sections as well, is because you're right. There are only so many times we can talk to someone in a day.
Yeah.
Also, the community caregivers, they do these lunchtime chats. They've been starting ever since COVID to help with seniors. So I can't remember if it's like every day or a couple times a week, but they have just like people come in and do like random topics to entertain people, and any seniors are allowed to attend. So you might want to check that out too if you know anyone who might be interested.
Excellent. Thank you so much.
Yeah. Great. Well, thank you so much, Veronica, for joining us and for giving that overview. And there are no more questions. We will turn it over to Lynn from CHAMP, who is here to talk about their program and to give us some tips on accessing mental health services.
Great, thank you. Thanks everyone for having me. I'm going to switch over to my PowerPoint presentation in a minute, but I just wanted to introduce myself. So I'm Lynn Goldberg. I work with the New York State Council for Community Behavioral Health Care. So the main work of my organization is typically to represent mental health and addiction providers around the state. So it's really more of a lobbying and advocacy kind of an organization. But in 2018, when the CHAMP project was developed, I was brought on board to be what's called a project specialist for this program. So I provide training to the CHAMP helpline, which I'll tell you about, and to all of the different partners that work with the CHAMP program and provide consultation around the cases that they're working on. I'm a clinical social worker, and a lot of the folks within the CHAMP network are attorneys or case managers, so we all kind of work together, and I have a really great role to be able to do work with them. And then I also do outreach frequently in the community. Before COVID, I was going into staff meetings and organizations like yours. I know you come from a variety of settings and organizations. So if you think this would be of interest to the folks that you work with, please feel free to invite me to come and talk with you as well. And I'm really glad that you're here today. So I'm going to switch over to my slides, and feel free to put any questions in the chat box. And I think if they're pertinent to the subject that's happening, I'll try to address them right then. But if not, we'll have time at the end as well. All right. Shelby and I practiced this morning, so I should be able to do it. There we go. And all right. It might take a minute to respond to being a slideshow. But in any case, I'll get started. So I was going to be joined today by with my colleague, Stephanie Campbell. Stephanie is a director of the New York State Office of the Ombudsman Program. So Ombudsman is really a fancy word for advocate for individuals who are trying to access care in this situation. Stephanie is a person with a lot of personal lived experience as someone with both in the mental health and in the addiction world. So she brings a lot of personal experience as well as her professional experience to the table. And so we get to work together as she's the director. And then I introduced myself to you. So today I have quite a lengthy slide presentation, and Shelby said she'll send this to you afterwards. I will try to focus on what's important. And if you have any questions or want to talk about anything in more detail, we can do that if time allows. Shelby, I noticed that the time frame of the meeting was until 3. Do we have until 3 p.m.? Is that right?
Oh, well, that's unfortunate because I had meant for it to be from 2 to 4.
Okay.
I would just go ahead till 4, and then if people have to jump off because of the scheduling thing, that's okay. We are recording it, and I will send it all to you afterwards. And I apologize because I did not know that.
Okay, at least that's what I see on my side. So I just wanted to make sure I had it right. So we're going to talk a little bit about the timeline for mental health parity in New York State and the state of care, some legislative information, and then really want to focus on telling you about what CHAMP is, because it's a resource for you and the people that you work with. So that's probably the nut of this presentation, the most important thing. There are some health insurance basics in here. I know that some of you actually work for health insurance companies and probably have that information. It's valuable to know in terms of advocacy if you're working with someone whose insurance company might be denying care or putting forth restrictions that you or the individual feels is unfair or illegal. There's some information that can help you. So I'm going to get started with this. So stigma really is at the crux of a lot of individuals who are unable to access care or unwilling to access care. There are a lot of negative public perceptions about mental health and substance use disorder treatment that make people ashamed to actually go forward with care. Sometimes the stigma can be imposed by their own communities due to cultural considerations. Sometimes it's due to their families, to their providers even, but it can be, if you are paying attention, which I know that you all are, to some of the changes in the way that mental health care is perceived, you know that a lot of emphasis is being put on helping to overcome stigma and shame to be able to get the help that people need. So let me try to move this off my slide. There we go. So suicide rates have impacted across the state. There's some information here about increasing 28% between 1999 and 2017, which is a huge increase. It's the second leading cause of death among children 13 to 19. It's the fourth leading cause of death among individuals 35 to 54. And in most cases of suicide, at least at the time of this slide development, 2/3 of those individuals who actually died by suicide did not ever receive the help that they were looking for or didn't seek help because of stigma. So here's some common insurance terms. I'm actually not going to go over them, but they might be useful for you. You may be working with individuals who have taken the first step to try to get treatment or get care, and they get a letter or some information from their insurance company that may not even be a rejection. It might be just informational, but those informational letters can be very anxiety-provoking because they use a lot of terminology that people don't always understand. Even though they make an effort, all the insurance companies do, to provide written information that's understandable, there's still a language unto themselves within the insurance company. So some of these may help you in your work with people that are trying to ensure that they get care. One one of the reasons that CHAMP, I'll sort of slide this in now, there are a lot of reasons that individuals have problems accessing care. Stigma is one of them. It can be just a lack of providers in a particular area. Right now, you're probably seeing some people finding difficulty getting care because of the situation with COVID and restrictions that are being imposed on the delivery of care. But the CHAMP program, CHAMP stands for Community Health Access to Addiction and Mental Health Care Project, was actually started with a primary goal of identifying and overcoming insurance barriers to care, especially those barriers that are illegal or too restrictive. So you'll see a lot of information about insurance in this slide deck because Stephanie and I, as we develop it, we want to be true to the nature of CHAMP. But the truth is that we work with a lot of people who are having other kinds of issues, like just the lack of a provider in their area. So any type of access to care concern to getting mental health or addiction care is a valid reason for you as a person that's helping someone to use the CHAMP program as a resource. But in any case, mental health and substance use disorder care has been subject to some restrictive requirements by some health insurers. Not so much our local agencies, our local insurance companies. CDPHP is really great, MVP is really great, but some of the larger companies have actually been fined for their restrictions by limiting the number of sessions an individual can have or imposing varying cost disparities between physical and mental health. Those are the kinds of things that the CHAMP program gets involved with. A lot of people find that mental health and substance use disorder care costs more than physical health care because they more often have to go out of network, which even if their insurance company has an out-of-network benefit, going out of network costs more. They don't, they're not subject to the limitations of the insurance company. Also, providers typically have been paid less for a similar type of procedure. So that's an issue and also speaks to why sometimes there are difficulties finding providers. These disparities worsened. They didn't get better even with all the parity laws that were changed. They worsened between 2013 and 2015. And there have been 6 and then even more since then settlements by the New York Attorney General against New York health plans for violations, despite those laws being in place to prevent that. There are some other issues too. If an individual has commercial insurance, you know, we think a lot, especially around mental health, that I'm just going to move this so I can see my, I don't know how to get rid of all the little faces on the side here. People who have substance use disorder and who have Medicaid are twice as likely to be able to access treatment than those with commercial insurance. I know my background is in mental health, and my experience is that individuals with Medicaid have a hard time compared to individuals with commercial insurance in accessing mental health care. But substance use disorder care is a lot harder to access and to maintain because of the costs involved. There sometimes, you know, attending outpatient appointments, maybe if a person's in like an outpatient rehab program, they might be paying for services several times a week, and the co-pays add up very quickly and make it unaffordable to individuals. There have been some changes to the laws that have made that a little less restrictive, but that's one of the things that makes it hard for people to access care. So let's see. So I mentioned parity. Parity is, if you don't know what it is, it speaks to the importance of equality or equity between mental health and physical health care. So in other words, if a person has an insurance company that covers mental health care, which they don't all cover it and they don't have to, but when they do, they have to have similar requirements for mental health and physical health care. So if they're going to outpatient physical health appointments with no restrictions or limitations on number of visits, they have to also, on the other side, have no restrictions or limitations on their mental health outpatient care. There was a time, and it still happens sometimes, excuse me, that insurers will say, you know, a person can only have 12 appointments or 10 appointments, and then they have to be subject to approval again. Outpatient care for physical health is not subject to approval for regular physical health care, so mental health care should not be as well. So also the cost. If going to your doctor for a regular physical health appointment is a $20 copay, then your mental health outpatient appointment should also be a $20 copay. Your psychiatrist might be a specialist copay, but your regular care is taking care of your physical health is akin to taking care of your mental health. So this is kind of a timeline up until most recently. Stephanie was going to talk a little bit more to the 2020 parity enforcement changes. There, she's referring to what the governor talked about in the State of the State address. But I think for the purposes of our conversation, the most important thing to know is that there's been a progressive and continuous emphasis on ensuring that access to care for both mental health and addiction is improving and improving, and that any of these parity limitations are addressed. What she's talking about in terms of enforcement is that there have been laws in place and there have been audits at times by the Attorney General, particularly of insurance companies. The state has not set forth any actions to really enforce the enforce consequences, like charging. I'm blanking on the word, but being any of the enforcement actions that they, like fines. I'm sorry, I'm getting home. The fines. There have been no efforts to enforce any of the legislation, which makes it very difficult to actually ensure, because if people aren't going to be held accountable, if companies aren't being held accountable, then they have no motivation to really make the changes that they're required to make. So these are just some of the changes. 2019 was a big year for insurance law changes. Right now, many of you might be familiar with the locator tool. That's the tool for evaluating, for assessing an individual's appropriateness for different levels of outpatient and inpatient substance use disorder care. They're now looking at tools that could potentially be comparable for mental health care as well. Looking at, there's a lot of discussion about that right now, but the idea, I think the Office of Mental Health feels that it will make it more standardized across the board to be able to ensure that everybody's being assessed fairly and appropriately from a clinical standpoint. Some of the changes were made around reviewing care, allowing for quicker access to care, reducing authorization for certain formulary requirements for medication-assisted treatment for substance use disorder. Let's see what else. Prohibits retaliation by insurers against providers who complain about parity violations. It reduced, it actually eliminated prior authorization for adolescent mental health inpatient treatment. There were some parity protections for mental health and autism services. And this, if any of you work with individuals with developmental disabilities, this is specifically talking about Medicaid coverage for ABA treatment, for what's considered evidence-based treatment for autism. And this was supposed to be effective in 2019. And unless any of you have a different experience, I have yet to find this being implemented, that, you know, despite the governor's commitment to making sure that treatment that treatment would be available, I have yet to see this in action. So it is a benefit that individuals with commercial insurance can access, but Medicaid, I don't see that they've been covering it. So we talked earlier, they've limited some of the settings where co-payments for continuous visits in a week, like there can only be so many co-payments in a day or a week in large group practices. So if an individual goes more than once a day or once a week, they can only be charged a limited amount, and hopefully that will make it more affordable to them. This is information about telehealth, and this has to do, Stephanie included links. If they don't come through in the PowerPoint when you send them out, you can let me know if you're interested in any of this. As you know, telehealth has really increased this year, and it's been made a permanent part of the federal and the state approach to delivering treatment. There are times when it's not preferable compared to face-to-face, but it's been a really big boon to those of us who feel like individuals maybe who don't live near a clinic or an individual who can provide services, or because of COVID or illness. There are many circumstances where access to care can be greatly enhanced by these telehealth changes that have allowed for telephone and video therapy. There are also some issues about that that have been brought up in legislation this year. The federal budget includes money for expanding the availability of technology to like rural communities, tribal communities, to be able to have access. If you don't have access to the internet, then all of these telehealth changes are very limited in their ability to be helpful. So there's a lot of money right now to not just allow for these telehealth changes to become permanent, but also to improve the infrastructure and the availability of technology for individuals in different settings, including like in homeless shelters and rural communities, to be able to make sure that people can actually access them. So here's some more information. Excuse me. Very significant. Here's some more information about parity and the enforcement of parity compliance. So I wanted to skip a little bit to let you know about something that actually has been effective since last year. It's a recovery tax credit. So this is, in New York, is the first state in the nation that provides a tax credit for employers who hire individuals who are in recovery from substance use disorder. It's a program that was developed before COVID. I'm not sure what the state of it is today, but I'm pretty sure that it's ongoing. If an employer provides the opportunity for eligible individuals to work, and it talks about some of those requirements right here about the hours and so forth, then they will get a tax credit. And a couple $1 million was appropriated for that program last year, and I hope it continues because it gives, there are a lot of opportunities for people in recovery to work within the recovery community, whether it's mental health or addiction. There's, there are certifications to become peer support specialists, but it's more difficult a lot of times because of legal backgrounds, having been in jail, and other issues, that individuals in recovery have trouble finding work outside of the recovery field. And this has opened up the doors for a lot of people to work in fields where they may have formerly worked and have expertise, or to get into fields that are of interest to them. So it's a really great program. So that's kind of the background. CHAMP started in September of 2018 with a collaboration between the Office of Mental Health and the Office of Addiction Services and Supports. Community Service Society, which is an agency in New York City that runs a lot of the health insurance navigation programs around the state, along with other programs, they were tapped to run the program. Excuse me for coughing. They have experience running helplines. They have a lot of the staff and the training, so it was felt like they would be a great addition to this program to be able to run it, and also to run the helpline portion of the program. Also work with the New York State Council for Community Behavioral Health Care, which is my organization, the Legal Action Center in New York City, which is an advocacy organization for rights to, especially around substance use disorder care. It's a legal advocacy organization that is very involved around the parity issues that we talked about earlier. And for some reason not on this little handout is Medicare Rights Center. Medicare Rights Center, it provides support and training to our whole team around issues that impact individuals who get Medicare, whether they're elders or people that are younger that have that may have Medicare along with Medicaid. They work very closely with us to make sure that we understand the rights and limitations for people with Medicare. So if you were working with someone who has Medicare, I know there was a question earlier about connecting elders to social supports. If you have questions about accessing care, CHAMP would be a place that you could call. So we talk about, we can help someone understand their insurance rights. So if you're sitting with someone and they just got a letter from their insurance company and you don't understand it and they don't understand it, you can call CHAMP with them and talk to one of the folks on the helpline, and they will help you understand it and make sure that the person understands what they need to do or not in relation to that. We actually have attorneys as part of our project that will work with individuals to review and challenge denials for mental health and addiction care. So if somebody's inpatient and everyone thinks that the person really would benefit from continued stay, but their insurance company seems to be arbitrarily or illegally forcing a limitation on their care, CHAMP will review it and work with, their attorneys will work with you or their family or the provider. Anyone can contact them on behalf of someone to try to overturn a denial if it's appropriate, so the person can continue to get the care that they need. We try to help people make sure they get the most from the coverage they have. We work with providers to ensure that their reimbursement is fair if they have issues about their reimbursement. We also can connect them to options for either care, like particularly if you're working with somebody and you're trying to get them into treatment and you just can't find any options, you can give us a call and we might not know more than you do, but we'll help brainstorm options for them. Especially if you just seem to have tried to find your last option, we usually can come up with something. We also connect them to insurance. So CHAMP itself isn't an insurance navigator or insurance provider, but we can connect them to folks that can make sure that they get enrolled in an appropriate plan. So this is the helpline number, 888-614-5400. It's Monday through Friday from 9 to 4, and there's always somebody available during that time. We hope over time that the budget for CHAMP will increase and we'll be able to actually increase our hours to evenings and weekends too, but so far that hasn't happened. So I told you all about this. There's also an email that's at the end of the slideshow as well, and that email goes to Stephanie Campbell directly, ombuds@oasis.ny.gov. She can be contacted about any issue or concern that you're having with mental health or addiction care, especially if you feel like you want to engage the state around the concern that you're having. You know, calling her is not an official complaint, but she can kind of put you in the right direction. And here's a bunch of insurance stuff. How it got there, I don't know. So I talked to you about Community Service Society as being kind of the central organizer and manager of this program, and then the specialists are the Legal Action Center, the New York State Council, and the Medicare Rights Center. And then we also have branched out to include 5 community-based organizations around the state. They were intended to reflect the areas of the state where there have been increased suicide rates and individuals impacted by the opioid crisis. Right now we have 5 regions represented, and again, if we have the opportunity to expand, we would like to do so. The one organization that kind of covers the Capital Region area is Adirondack Health Institute. You might know them as a health home. They have a lot of great programs, and they've been a really good partner in this program. So if you're working with somebody, particularly in the Capital Region or North, they're a good organization to work with. So if you were talking with somebody in your office or out in the community who you felt would benefit from some help from CHAMP, you could contact the helpline right away, and they potentially would get you in touch with one of these community-based organizations to help you face-to-face or on the ground with that person. We work with anyone regardless of their insurance, if they're uninsured, regardless of their age or immigration status. So we've worked with children up to seniors, and we work with individuals with commercial insurance, Medicare, Medicaid, and as I said, uninsured. And working with us, if someone is an undocumented immigrant, will not put their immigration status in any kind of jeopardy. Here's from our brochure. Kind of describes what I already described to you. One thing to say that we keep track of what we call sentinel trends. So these are issues that are bigger than us, like I mentioned the ABA therapy, so far not being able to access evidence-based treatment for children with autism spectrum disorder. That's an issue that needs to be discussed. So we keep track of cases, and we do research around those issues, and we present a report every year to the state about that. And there are many other issues that we really can't impact because the legislation is not there for us. Here's more information about insurance, and you are welcome to review it. There are plans you should know about that are not covered by New York state laws. So if the policy is issued out of state, the policy, for instance, somebody could have a Blue Cross Blue Shield plan. They may live in Albany, but their plan comes from Wisconsin or Michigan or from another state because their employer purchased an insurance plan from a provider that's out of state. So the laws that relate to insurance in New York don't apply to that individual. They can still contact us, and we'll do our best to help that person. And then self-funded programs. So, if somebody's, let's say they have an insurance company, but actually the insurance company is just a sort of the administrative manager for the plan, but the employer themselves is paying. Some of, like GE, I think Union College, there might be some places like that around in the local area that they're not subject to insurance laws. But again, you can still contact CHAMP, and we'll do everything we can. This is a website that you can actually know if the plan is covered by New York State law. And then these are some resources which you can feel free to add to your resource guide if you'd like. There's the program directory. There's also information for children, teens, and families, and then some specific information relating to youth, individuals with first episode psychosis, and so forth. A lot of these you probably have on your resource list that you went over today. And then this is our contact information. So the CHAMP helpline will get you assistance for people that you're working with, but you can call me. This is my phone number. This is how you can reach me by email. If you have any questions for me, I'm happy to try to, respond to you. But also, if you'd like me to come and talk with your groups, I'd be happy to. And I think I saw some questions that might have been coming through, but I couldn't access them with the slideshow open.
We had a question about if the slides were going to be available. Yes, I will send out an email to everybody who registered tomorrow with the slides. We do have a question here from somebody who is a SERPA and a peer specialist who would like to know, do you work closely with people in these roles, and has there been a higher demand for these services during the pandemic? And how do you see these roles evolving after this pandemic, or how can we elevate ourselves in this role to help better the community?
Yes. I would say we have a very strong connection to SERPAs, to all the peer support specialists in the community, family support specialists, especially in the addiction field. And I know that's the requirement, but a lot of people also work in mental health peer. But I would say that the majority of the cases that I am asked to come in on have been referred by peers or in that role, because they are working directly with people. And it may be the same as, if all of you are working in some type of a case management role, it might be the same thing. But having the ability to bring lived experience to the conversation, I think, helps with engagement at times. So we end up working a lot with peer support specialists across all the different types of specialists to help people get access to care. Let me look at the question and make sure I answered it in more detail. So we do work closely with people in those roles. I just did a presentation with a family peer support specialist person because his organization does a lot of referral to our program. I think there has been a higher demand in general. The pandemic, I really don't know for sure if the pandemic, what the statistics would be, but I know that the folks that I know that are peers, they were the first ones going back to work and being in the office and being in the community. So I think there's a recognition that that's a really important role.
I will also add that we are working, one of the other initiatives that we're working here is working with the county health departments and local hospitals to help create a substance use regional strategy because we have been seeing on our end from the health department side, we have been seeing more overdoses. So we are going to be trying, we're starting a meeting. We're going to be trying to see how we can further treatment in that area. And a huge part of that is going to be SERPAs. So if you have interest in getting involved with any of that, feel free to shoot me an email and I would be happy to get you involved.
That sounds great.
Do we have any other questions on accessing services?
Is there anything, Shelby, that you wanted me to go into more based on the conversation? I know you and I talked ahead of time, but I don't know if there's anything in particular that you would like me to address.
Yeah, I think maybe just kind of touching on what we talked about earlier about how to kind of handle a situation when someone needs services and they're kind of taking it out on the case manager, for instance, because they're in crisis and not really understanding that the people that are helping them aren't an extension of the government of that side, but they often get kind of treated that way in a sense. So maybe if you could just touch on that a little bit.
Okay. I think, well, it can be a really long, complicated answer in a sense, because to engage someone who's in crisis, there are some training points and places of experience that can help you connect with people. And I don't know everyone on this call, but I recognize some names, and I know that there are some folks who maybe have training around motivational interviewing or using active listening. Those would be some things that perhaps maybe even considering doing some additional training within your organization, like within this group, if folks wanted to kind of bone up on those skills. Really, anyone, the circumstances of why someone could be in crisis or not being responsive to help can be really varied. The first thing, of course, is that a lot of times we look at somebody from the outside in the situation and we assess that they need help with something, and unless they're really endangering themselves or other people, they have a choice in whether they accept help and how they accept it. One of the things that I learned early on is because if someone's acting in like an unpleasant or aggressive, and by that I don't mean that you should be in a situation where you're physically in danger, but if someone is just kind of doesn't seem to want to talk to you, just being there beside them and listening to them is always the first step. I mean, it's not, none of us really know exactly unless we've been through it, and maybe from our own experience, but none of us know what that person in front of us is going through at that time. And the most important thing I think we can bring to the situation is empathy, listening, caring, and recognizing that they are the ones that have to make the decision to take a next step to get help. And the most valuable thing you can give them is your willingness to accept them where they're at and for what and who they are. I was on a call earlier with our CHAMP program, and one of our organizations around the state, one of the community-based organizations, brought up that there was somebody that he had led his Medicaid lapse. So because of that, he had moved from one place to another. didn't report it to the new place, and so his Medicaid had lapsed. And now he was having to pay out of pocket for his services in his new place. And the case manager was really worried about that and upset about it. And she had reached out to him a number of times to say, you know, how can I help you? What can I do? And he was saying, it's all right, I can handle it. The copay it's still cheaper than what I'd pay on the street for this medication. I'm good, thank you. And she just kept pushing and pushing because she, from the outside looking in, knew that, you know, he could probably get Medicaid and get help. But we don't know what's going on for this person. We don't know anything about the situation except that he's saying no. So really listening to what somebody's saying in the moment and leaving the door open to be able to respond to them when they're ready for you. I think that's the most important thing. So if you've, you know, kind of dig deep into your Psychology 101 to active listening skills, just listening, reflecting back, acknowledging, and being genuinely there for the person. And beyond that, it's probably a 2-hour conversation and training. And I see a couple people who are online, or you know, does anyone else who in your work have anything to add to that? Because I know all of you are working every day with folks.
My name's David. I'm from the Community Health Center in Saratoga. I think that was a fantastic question, and I almost want to piggyback off of it. I think I have a very large population of middle-aged to elderly alcoholics, and basically are just resigned to more or less drinking themselves to death. And it's just and I've done the passive, been there to be there, kind of catch when they fall, and to offer support. But I guess it's almost like a passive suicide that you're kind of observing. And I guess I'm almost trying to figure out, does anyone in the group have a suggestion for managing folks like this?
We have a comment in the chat. A lot of it is having to do with the client needing to be heard, just listening and validate what they're experiencing. Yep. Absolutely.
I'm sorry, I didn't catch your name. Was it John?
Dave.
David.
Yep.
Dave. Tim. Sorry. I know where I
I've been called worse. That's okay.
I think maybe going back to what I said before is, each of the individuals that you're talking about, each one has their own story and their own reason for where they are the way at this time in their lives. So taking as you're speaking with them, really understanding where they're at and, what brought them to that, and asking the question overtly, because I think the beauty of having so many individuals in our workforce who are peers with lived experience is that you can connect them to someone who may be able to take them further than you or I could, because of our background is I don't know your background, but for me, working alongside peers in almost any setting I've worked in the last 10 years, I found that they, connecting to someone who understands where they're coming from can help bring them along toward some more hope. I think a lot of times people in that situation, what you're reflecting back by sort of seeing them as somebody who's trying to kill themselves slowly is a lack of hope in living, and connecting them to someone with experience can reinvigorate that hope and help them get the help they need.
Thank you. I greatly appreciate it. You know, I, I've tried using, I almost hate to use this word, these carrots, the dangle in front of like, these past enjoyments, um, experiences and people that mean something to them. But I guess, when that flat out means nothing anymore, like, I can use an example. One was like almost a train ticket to Arizona to connect with the daughter, and that just means nothing anymore. One was drawing, and we can't draw anymore because we can't hold anything straight. Um, and for people who say, I literally have no purpose, I have a number of people like this, and I guess.
Well, I would also make sure that they don't have untreated depression that also needs to be addressed.
I have
Because
psychiatry on board. I have social work. I have visiting landmark in the home. I have visiting nurses, dietitians, and it's Meals on Wheels. And it's just still this, this kind of passive slide to watch.
I'm sorry, that must be really hard to see for people that you care about.
Yeah, it's hard, and
Yeah.
I guess if anyone had like I just use this forum here, I guess for another angle, you know.
I'm going through that right now with a couple of my patients. Like today, with the mental health, she's not coming to her appointments and she's not treating her mental health. And it's really hurting my heart. Like with the pandemic, like they're not coming out at all. So their mental health is not being treated.
Yeah, I don't think you can ask for a worse recipe for a number of people in this situation. It's just between the ongoing loneliness, the desperation, and
They won't even open the door.
yeah, yeah. And some of my agoraphobic folks are in that area are the same, and it's just
The schizophrenia.
yeah, the strong borderline personalities. Yeah,
She opened the door for the cops, but she did not. She won't open it for me. And we were really close.
uh,
Will she pick up the phone for you?
No, it's off. I went 5 days in a row.
Mm.
I went Friday. I went today too. I went Friday, Saturday, Sunday, Monday. And then I went today again.
So were the
I
cops
applaud
like a
you for your
welfare check?
effort. Yeah.
Yeah,
I'm sorry?
I was just
I
wondering, with
applaud
the
you.
cops, did you do? Oh, I'm sorry.
It's,
Was
it
it a
hurts
welfare
my
check
heart.
that you sent?
They did a
Yeah.
welfare check on Friday,
Yeah.
and she opened the door for the cops. And she lied, and she said she didn't have the money for the phone. And this month she didn't pay the rent.
This is a really, really challenging time for so many of our clients. And I think that with a lot of these individual client issues, um, I'm sure a lot of you are discussing them with your supervisors who may be more familiar with that particular client or what avenues have been tried in the past and what hasn't been tried. And if you haven't, this goes for anyone, please remember to utilize your supervisors.
did.
That is it. Great. Great.
We tried to do a supportive living, try to put her in the mental health, the intake, like to try to do it all over, and she doesn't come out. She won't open the door.
And the other thing I want to remind everyone of, which I fall into this myself and have been reminded by a supervisor in the past, is we can't work harder than our client.
Call 4607.
I'll repeat that because I heard somebody's PA came on, but we can't work harder than the client. And you know that old saying, like you can lead a horse to water, but you can't make it drink. And I hate to compare a real human to that, but it is our job to assess our clients, provide the support, recommend and refer them to different resources. But ultimately, they are people who are educated about their options and they still have the power to make their own choices. So
Yes.
we cannot lose sight of that because we will burn ourselves out. Very, very quickly. And it sounds like several people who've shared their personal experiences with clients, are working really, really hard and doing everything you can do. And accept that, which can be really hard, but you are doing everything you can. And ultimately, there's a lot that rests on the client themselves too. And it's not your fault if they don't make a healthy choice.
It's funny, that's the second time I've heard that today.
Right.
The director just emailed me. I don't know what she said, but
Thank you.
thank you.
Thank you for sharing and bringing up your own struggles here. I know it can be really hard.
It is.
It is. Thank you for all the work that you're doing. I really,
Thank you.
it's not, a
It's
lot
not
of times.
easy. It's not.
No, not at
Because
all.
you get close to your clients, and you see them deteriorate.
And you
Yeah.
care.
You care, yeah.
Yeah, it's definitely not an easy job that any of you guys are doing. And this is why, we try really hard to support you all and provide these spaces for you to have these conversations, just to talk with each other, because you all are, doing the same thing in different areas. We really want to try to help bridge that a bit with these forums. And speaking of, like, if there's ever something you are struggling with and you're consistently struggling with, like, feel free to reach out to me. I'd be happy to, do what I can. I've provided resource lists in the past. We make these guides based off of your feedback. And, if there's something that I can provide in a training concept, a training form, I will do that as well. So anything that we can do, we are here for you. Does anybody else
you.
have any barriers to care that they wanted to kind of bring up and talk about that they're seeing?
Again, this is David from the Community Health Center. I guess there's in trying to get visiting nurse services for some people, we have that could clearly benefit from it, but the behavioral health component is rather overwhelming. There's times I just can't get the services, can't come into the home because of the behavioral health component. I guess that's a barrier. So I guess is that something to, you mentioned earlier about appealing. There's few programs that offer visiting behavioral health. So I guess.
So are you talking about home care, like an aide, or
Like home care,
what do you
yeah,
mean by?
like visiting nurses. Again, this is for along the lines of the people I kind of described earlier. Um, uh, the new patient-driven grouping models has made it a little more challenging to get people in. Um, and I've had a couple people where the behavioral health accompanying diagnoses was you know prohibited services from going in.
Right. I think going back to what Veronica was talking about, one of the benefits of working in a community model like you're working in is that you have other providers that you're connected to. So in really challenging situations like that, I would bring the teams together and kind of brainstorm what's best for that individual. As far as CHAMP is concerned, it sounds to me more like this would be if the person, let's say they qualify, you felt they needed a mental health or addiction care service and they weren't able to get it for some reason. But what you're describing, if I understand you, is the person's own mental health concerns are making it hard for them to accept the help that they need for their physical care. In which case,
That's exactly. I have a very strong borderline personality disorder, and it's again where I'm just watching this person kind of just lose their ability to eat and
right,
control
right.
like her own functioning, and it's just and I think if we can just get almost a dash of companionship in, what a difference that can make. But
Right, and I think bringing the care team together to kind of brainstorm what are, there might be some non-traditional resources in the area that could fill that need, like, maybe they're like a faith-based organization or volunteers. There could be places, other ways that the person might accept a first step, but that could be something that as you and your team brainstorm together, because you all have the same goal to help this person, but everybody kind of knows their resources from their own backgrounds and experience. So I wouldn't take it on by yourself. I think this is where your team can help you.
great, thank you.
If that makes sense, yeah.
It does,
I don't know
absolutely.
if anyone has anything else to add to that.
Are you saying that agencies won't do in-home visits because there's a behavioral health concern, or that the person doesn't?
Yeah. This one particular company that I thought would be ideal because of some of their nursing specialty, but they're like they don't have any behavioral health components, and I guess it's more of a scope of practice. But this particular agency doesn't have anyone on the visiting team that's trained in behavioral health. They don't have like a nurse practitioner. They don't have it and in reviewing the chart, you could just see how the behavioral health component it like overrides a lot of the health and needs. So basically, just one service was declined, but mainly because of the behavioral health component. And I can see like that scope of practice, I guess, to a degree. But it was like I think that was my last Hail Mary pass. Again, this is one where I brought in psychiatry, social workers, palliative care, landmark. I've done short-term rehab. I've done MHU at the hospital, and it's again just a slide into which will be probably a catastrophic event in the home, like either a stroke or something.
Well, I do have in this group, we do have a few different agencies that do in-home visits, and I can definitely, take a look and try to see if there are any agencies that specifically feel comfortable with that, and see if I can, create a list together. And if I can find any, I will definitely share that with you.
Beautiful. Thank you very much.
Is there anything else? Any other barriers? Oh, we do have a question. Someone said that they have a client who is currently trying to see someone from the mental health clinic. I tried to connect him with someone, however, was told that I cannot do this for him and to have him contact them. He did, but hasn't heard anything since. Any recommendations on what I should do next? Was this a county mental health clinic? Yes. Okay. He's the case manager. Does anyone have any advice for him, Lynn?
If I may, my suggestion would be to call the clinic again and find out what yes, exactly. Somebody else wrote it in the chat, but call the clinic again, find out if he's on a waiting list, if there's any record of this. And see what their procedure is for that. And then find out, I guess, what the waiting list looks like. If there are 100 people on this list, if there's 5 people on this list, what the estimated time to wait would be, because it's hard to say. That varies so much from clinic to clinic. And if it's something that is manageable, great, then you just need to help support him until he can get an appointment. And Anthony, what county are you in? Okay. With Columbia County, let's see. My other suggestion is to perhaps call the living room. They have a location in Schenectady and a location in Rensselaer County. But you don't need to reside in those counties to utilize the services. And everything's telephonic now because of COVID anyway. So they may be able to provide some extra support or ideas for next steps to you. But I think that I think more so for your client, he can call them for additional support while he's waiting.
Can I ask, is it possible for Anthony, for you to actually come up with a time when you can call with the person on the line? Sometimes, like, do a 3-way call and just so you can be supportive. If you're the case manager, you could be supportive of him as he's making that call and kind of be available to interpret if need be, but still meet that requirement that they have.
Great question. Anyone else have any barriers that they're running into? Like some discussion around, some advice?
Shelby, could I address a couple of things that have been coming up more recently that we've seen that might impact some of the folks that you all are working with?
Absolutely.
One is we've been getting a lot of calls to the helpline and to our program for individuals who have addiction, like they might be needing addiction care, but they also have a mental health history. And some addiction programs, like Conifer Park and some of the local ones, have been reluctant to take them, even if the mental health history is in the past, or if they may have been suicidal at some time, but they aren't currently. It's hard to find a person who's experiencing addiction concerns who doesn't have some kind of mental health concern as well. And some of the programs are saying that they won't take them. And so if you are experiencing that and you're not able to find a program, please call the CHAMP helpline or write to the Ombuds email address. We can work with you as quickly as we can, as quickly as possible to get somebody who's motivated into treatment. There are programs all around the state that do specialize and do take people, especially the addiction treatment centers that are state, OASIS run, state run and funded. And the same with lack of insurance. No one who doesn't have insurance should be denied care. And if you're facing that, we can work with them immediately to help them get into care and to work out whatever payment arrangement or get connected to insurance if they're eligible. But when someone's motivated, we don't want you to take too much time to try to find care when we can help you quickly if somebody's ready to get what they need.
All right. Does anybody have anything else that they wanted to add?
Can I just chime in? I missed like most of this. We had a different meeting, but I'm a certified. I'm a SERPA, somebody in recovery, somebody who's been through the substance use and mental health treatment facilities in the area, and I just wanted to basically give a shout out and talk about a couple things that I've used the CHAMP program many times. Me and Stephanie are Stephanie is a bulldog and I love her. But a lot of times I get people like she was just talking about with, too many mental health, concerns for rehabs to take, or I'll have, recently I've had somebody, he had, a couple strokes this year, or, people on blood thinners, or, somebody in a wheelchair that, you can call around as many places as you want. And as soon as they hear some of the details, they're going to say, we recommend you go somewhere else. Why don't you try this number? And the CHAMP program has gone above and beyond and, come up with places that I've never even heard of in the state and gotten people in as quick as possible, and worked with different agencies in the Capital District to set up transportation and to have peer support. So I basically just wanted to say hello, and I've had success with the CHAMP program. I think what you guys are doing is great, and sorry I missed the first hour of this, but I hope everybody's doing well. And like she said, thanks a lot to everybody who's doing this kind of work. It's not easy. It's, there's, small victories and, slow change. And, it takes a certain type of person to do what everybody here is doing. And, I just wanted to say, thank you as somebody who's received help from folks like y'all. And it's been totally worth it. So thank you.
Thank you, Kevin. I'll tell Stephanie.
Thank you.
So.
She said she was going to be here. She lied.
I know. She did lie. She lied to all of us. But she got called into a couple meetings, so I apologize for that. I'll write your name down.
Kevin, I did mention this too earlier when you weren't here, but we are, one of the other initiatives I'm working on is a substance use initiative. And we've got all of the 6 counties of the Capital Region and hospitals on board to kind of help figure out a regional kind of strategy to help address the recent increase in overdoses that we've been seeing. And so if you are interested at all in having any part of that as from the SERPA perspective, just to shoot me an email, because we would, we'd like to have that perspective as well. I'd like to have, the on the ground people, and then, all the full spectrum. So just a heads up if you're interested in that.
No, I appreciate that. I've been talking a lot with people about the Matters program and medicated assistance treatment in the local emergency rooms, and hopefully moving forward with that process. And I spent a lot of times in the area, emergency departments, and have a lot of different opinions and views and experiences on all that. So I would love to be a part of it.
Great. I'll put my email in the chat right now just for anybody, even if you're not a Serpa, if you're interested. You can shoot me an email and I'll send you the invite.
Okay.
Does anybody else have anything that they want to add to the discussion? Okay. Well, if there isn't anything else, we can go ahead and end a bit early. I want to thank everybody for being here today, and thank you all again for your work. And just know, as much as I can, feel free to email me about anything if you're having trouble finding resources, or if you, if there's a specific skill you'd like to work on, anything like that, just send me an email, and we'll try to provide whatever we can for you, guys, as a supporting organization. And I'll send out an email. I'll cut the recording, so I won't have the question and answer part in the recording, just because we were kind of talking about a little bit more personal stuff. So I'll just have the champ portion of things in the recording, and I'll send out the slides and everything like that. So feel free to reach out, and I hope you all have a wonderful day. Thank you again for coming.
Thank you so much for having me.
Thank
Great
you.
to see everyone.
Bye-bye.
Bye.
Thank you for having me and for all your questions.
Stay safe, everybody.
Yes, stay safe.
You too. Stay safe. Wash your hands.
Yes.